Good afternoon, everybody. Before I begin, I would like to recognize Dr. Raj Yadav, Acting WHO Representative to the Philippines, Ms. Tina Arceo Dumlao, Business Editor of the Philippine Daily Inquirer, and Ms. Mona Khalil Maceda, Marketing Officer of the Philippine Daily Inquirer, and all of us here today at this event. A pleasant afternoon to all of you. On behalf of the Department of Health, I would like to extend my appreciation to the Philippine Daily Inquirer for providing us a platform to share and discuss the different measures of living with COVID-19. This will be the outline of our discussions for today. To begin, let me give everyone a brief overview of the current situation of COVID-19 in our country. We are seeing a continuous decline in the number of cases of COVID-19 in our country. The average number of cases from April 14 to 20 have gone down to 236 cases per day, which is 11% lower than the previous week's average number of cases. This is now lower by approximately 254 cases compared to the cases we saw at the start of December 9, at 490 cases per day prior to the Omicron wave. With a decline in our reported cases, our healthcare system's capacity is also at low risk. Only 18% of our total COVID-19 dedicated beds and 16% of our ICU beds are being occupied. Furthermore, majority or around 69% of our COVID-19 hospital admissions are mild to moderate cases, whereas severe and critical cases only comprise of 11% of our total COVID-19 admissions. With the continued decline in cases and low-risk healthcare system capacity, let us look at the strategies and guidelines moving forward. Recognizing that defeating COVID-19 necessitates a response continuum, we have adopted the prevent, detect, isolate, treat, and reintegrate strategy, which remains to be the cornerstones of our national COVID-19 response. Immunization remains to be one of the most essential public health interventions to defeat a pandemic. This is integrated into our PDITR strategy through the National COVID-19 Vaccine Deployment Program. We want to reiterate that this PDITR Plus strategy cuts across all settings, most especially in the workplace and transportation to and from the workplace. This remains critical as asymptomatic workers can carry the virus home, where adherence to minimum public health standards can be understandably more lax. The prevent aspect of the PDITR Plus strategy is further divided into engineering and administrative controls, as well as personal protective equipment. Offices and workplaces may now operate at 100% capacity. However, they may continue to provide flexible and alternative work arrangements as per the latest guidelines released by the COVID-19 Interagency Task Force for managing emerging and re-emerging diseases. To guarantee a healthy, safe workplace, we must ensure the following. There should be a safety and health officer who will be responsible in ensuring monitoring and evaluating proper implementation of our minimum public health standards. There should be a contingency plan, which shall include coordination with the local government and healthcare provider networks and management of staff and visitors with COVID-19 symptoms. There should be good air exchange, which shall be consistent with the Department of Labor and Employment guidelines, installation of hand hygiene and sanitation facilities, visual cues and signages on mask wearing, hand hygiene, DOH hotlines and other health and safety reminders, a mechanism for provision of care and referral of patients with symptoms or other emergency health conditions, structures for active transport, a smoke and vape-free environment, support to mental and psychosocial needs, especially of our vulnerable groups, and available context-specific and localized health and safety education materials. Under personal protective equipment, all individuals should wear well-fitted masks at all times, which shall be worn properly, whether in outdoors or indoors. The management of COVID-19 shall be consistent with the latest recommendations from the Philippine COVID-19 Living Recommendations. Close contacts, asymptomatic confirmed cases, and mild to moderate confirmed cases shall be managed at the primary care level, such as your local health centers or private clinics via face-to-face or teleconsultation. Health facilities are encouraged to adopt or scale up telemedicine to facilitate delivery of appropriate health services. A reporting and coordination mechanism must be developed with the local government unit for referral to health facilities, access to a healthcare provider network, telemedicine, and the provision of medicines and psychosocial services. Safety and health officers shall regularly monitor the status of employees who are quarantined or isolated. And to ensure adequacy of medical assistance, it must be ensured that employees, regardless of employment status, are enrolled and adequately covered with PhilHealth benefits. The implementation and rollout of our COVID-19 vaccine serves as one of our best strategies in this public health emergency. We cannot stress enough the importance of vaccines to prevent severe illnesses. Institutions are encouraged to provide support to facilitate vaccination of their eligible workers and coordinate with their local governments for vaccination in accordance with the national prioritization framework of the country. Regardless of vaccination status, minimum public health standards must be ensured at all times. However, it is also inevitable for us to continuously readjust our strategies as we marvel on the road towards the new normal. Before 2020 started, we did not know what COVID was. Now we can do genetic sequencing and have many studies going on at the same time. Before, no one had immunity from COVID-19. Everyone was at risk of severe disease, especially the elderly and those with comorbidities. Now, many of us have immunity from severe COVID-19 and deaths because millions of us had been vaccinated already and some have recovered already from COVID-19. At the start of the pandemic, we did not know what medicines worked when COVID-19 disease progressed. Now we have more and new drugs being developed and studied, including drugs that can be taken to prevent disease progression. Most importantly, the available vaccines that we continue to give to the public have helped us turn COVID-19 into a manageable outpatient disease. Let us then quickly define the term endemic. Endemic means having a replication number at acceptable values and that society as a whole has already identified an acceptable disease burden. With this, we want to clarify current misconceptions about the term. It does not mean that we do not have national government actions anymore, nor it means removing our COVID-19 safeguards. More importantly, it does not mean that the virus is safe or that there will be no disruptive waves in the future. Going through how the word is being used globally, what people usually associate is the removal of pandemic restrictions. For example, national government will still communicate the preferred actions for safety, but there will be no national restrictions anymore, such as lockdowns and the limited use of mandates. Largely, it means a shift to self-regulation. Lastly, we want to highlight that these measures assume wide-scale access to vaccination, boosters, and medicines. So groups who cannot access these are still high risk, especially the unvaccinated, those immunocompromised, our healthcare workers who have to manage the healthcare system, and areas with inequitable access. The road to easing restrictions towards a new normal has to be a balancing act. Theoretically, viruses tend to mutate to prefer transmission over virulence for evolutionary survival, meaning more infectivity than greater severity, as seen in the Omicron variant compared to the Delta variant. However, new mutations can still be deadly, and there is no predestined evolutionary outcome that they mutate to be more benign. Individually, immunity, whether through vaccination or prior infection, will have some theoretical protection over most new variants. But variant mutation is unpredictable and will continue, especially in immunocompromised hosts. As an example, the Omicron variant is assumed by some experts to have come from an immunocompromised host in Africa wherein vaccination coverage was very low. For our community, we know that higher common knowledge, skills, and access to tools and actions will be necessary for appropriate self-regulation, but that is dependent on equitable access, especially to the marginalized. Greater complacency can also promote increased transmission, further risking vulnerable groups. When we say adapting to the new normal, our strategies on reintegration do not solely involve the efforts made to reintroduce an individual to a society, but also focuses on allowing the whole population to adapt to the new normal. Key considerations for the gradual easing of the lockdown restrictions introduced by many countries in response to the spread of COVID-19 across the globe varied. As the transition out of lockdown remains to be a complex and uncertain phase, it is then vital that we clearly communicate this to the public to build trust and to ensure that people observe restrictions specific to their situation. The approval of decisions to open sectors and specific institutions shall be based on the following components: gradual and strategic opening of activities wherein the benefits of opening outweighs the corresponding risks. Evidence that COVID-19 transmission is controlled based on the community risk case classification level of the specific area. Minimum public health standards and capacities are in place to prevent, to detect, isolate, treat, and reintegrate cases and close contacts. Outbreak risks are minimized in high transmission and high vulnerability settings, and stakeholders are involved, consulted, aware, engaged, and participating in the preparation for the gradual reopening transition. As we continue to ramp up our efforts in adapting to the new normal, the safe reopening of the Philippine economy will be vital in addressing the enormous revenue loss brought about by the pandemic. This encompasses promoting economic activity while mitigating the risk of disease transmission and with emphasis on the adherence to the minimum public health standards. As the number of individuals getting fully vaccinated increases steadily, easing of public health standards for fully vaccinated individuals is also being discussed with our experts while ensuring that the population is protected from any emerging risk. Likewise, a phase type easing in the use of personal protective equipment may be considered. To provide cumulative protection, we have different layers of interventions. At the individual level, protection is provided through COVID-19 vaccination, which protects against severe disease and death. Appropriate and well-fitted PPEs also include added barriers to infection. At the level of the workplace, we recommend alternative work arrangements if applicable, reinforce the roles of safety and surveillance officers to ensure the application of our PDITR strategies in the workplace. In our households, we can also have that layer of protection by ensuring that people we are usually in contact with are vaccinated. Also ensuring household disinfection and minimum public health standards implementation at home remains important strategies for reducing infection. And finally, at the level of the community, we must ensure that the most vulnerable and exposed are protected because they are the groups that also demand healthcare to be admitted in our healthcare facilities. As we transition to the new normal, there would be needed transitions to be undergone by our healthcare facilities as well. To guide our planning, we define the scenarios of the endemic and transition phase. The transition phase is characterized by the partially controlled incidence of cases as opposed to the uncontrolled and sudden increase in cases in the pandemic phase. The endemic phase is marked by persistently low levels of community transmission. However, we are still expecting sporadic localized outbreaks or surges in these phases. During this phase, a high immunity of the population due to vaccination and natural infection has been reached. These scenarios will be updated with the guidance from the different partner agencies of the Department of Health. In general, we see a transition into a COVID endemic phase for our healthcare facilities. From a pandemic phase, which requires COVID-19 dedicated beds in all hospitals, we shift into the transition phase, where only selected government hospitals will be required to dedicate beds for COVID. Finally, we are looking at an endemic phase wherein dedicated COVID beds are no longer required, just like what they have planned in Singapore, and we treat COVID just like a seasonal flu, measles, and any other infectious diseases whose infected patients shall be admitted at any healthcare facility following infection prevention and control measures in place. For the temporary treatment and monitoring facilities, the repurposed structures such as schools and stadiums will be reverted back to its original purpose. Timelines may vary depending on recommendations from consultations with pertinent stakeholders. For newly built TTMFs, local governments are to check whether the structure is needed based on their local contingency plan for future surges in consultation with the regional offices. This may still be used for health-related services such as isolation and quarantine facilities or step-down care or even transition care or halfway houses. If there is no identified health-related need, consider conversion into learning centers, socialized housing, evacuation sites depending on structural integrity. Finally, these structures may be closed, transferred, or stored depending on the decommissioning plans of the local government. For modular facilities built inside hospital compounds, we may continue their operations as isolation rooms and ward extensions or may be repurposed as staff quarters or dormitories. For modular facilities built outside hospital compounds like Quezon Institute, the Center for Health Diseases, in coordination with the managing hospital, shall implement decommissioning plans. If the modular facility is a repurposed structure, it may be reverted back to its original purpose. If these facilities are newly built, they may still be used as isolation, quarantine, step-down care facilities, or they may be closed if there is identified need with the endorsement of equipments to an identified appropriate facility. Before we end, let me give you a glimpse on how we envision having healthy settings in the new normal. We will continue to reiterate that behaviors are key to achieve good health. People need to eat well, exercise, manage stress, and avoid substance abuse to stay healthy. But it is not enough to know that a behavior is healthy for a person to start practicing such behaviors. We also acknowledge that we cannot focus on individuals' knowledge alone, but on the circumstances surrounding them, their peers, their culture, the laws, services, and the products surrounding them that would prevent them from practicing healthy behaviors. The healthy settings approach is an important strategy in ensuring the uptake of healthy behaviors. It offers opportunities to mainstream health and keep health top of mind by reaching Filipinos in the settings of their everyday lives. That would be at home, in school, and at work. A healthy workplace would also need a healthy community to provide the needed continuity in looking out for their employees. We recommend the following changes be effected in our communities: ensuring improved access to safe and nutritious food with clean, potable water, opening up public spaces and varying infrastructures which promote active mobility, physical activity and leisure, and safe road use, making sure that our environments would have hand washing stations and proper waste management systems, warranting that housing conditions are made affordable, accessible, and livable, providing more smoke-free, vape-free, and drug-free environments to allow a more conducive environment for healthy growing and aging, ensuring that Filipinos earn a reasonable wage in an environment that also takes into consideration their physical and their mental health, making neighborhoods safe from violence and neighborhoods that are inclusive and harmonious across all ages, genders, sexual orientations, and social status, and strengthening local health systems to be more responsive and improving the availability and accessibility of essential health services among communities. And in order to have a healthy workplace, our standards of how we run our offices or businesses needs to be revamped in order to appropriate the change we want to see. These changes would include improving ventilation through engineering and administrative controls, allowing mechanisms for ensuring minimum public health standards are followed as applicable, and institutionalizing alternative work arrangements and appropriate referral mechanisms as needed. Ensuring healthcare is provided through managed care and health commodities by the employers, and strengthening linkage to local health system and services for appropriate management. The new normal refers to emerging behaviors, situations, and minimum public health standards that will be institutionalized in routine practices and will remain after the pandemic. Normal life is when infection prevention standards are permanently incorporated into our basic standards for safety and healthy communities, workplaces, and schools, aligned with our Philippine Development Plan. As we usher into this new normal, we continue to remind everyone about the importance of the minimum public health standards and vaccination. Let me end my presentation with this reminder to all of our kababayans. COVID-19 might be here to stay, but if we work together and act on our roles, we will all become contributory agents in reducing the impact of this virus, and we will all be able to continue our overarching purpose, that would be to be of service to the nation and give service above ourselves. The Department of Health will continue to be your ally in serving other people and in changing the lives of our Filipino communities. Thank you for listening, and good day to all of you.